Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, microcurrent has become a really hot topic in this office and in Western Pennsylvania, really, and certainly due in large part to the arrival of a young lady who keeps on coming back each and every month to give us more information about this microcurrent topic. Now, look, there's up-and-coming training seminars, and she's going to be teaching them. We thought we would sort of open that whole topic up today and let you know, if you're interested in microcurrent, that if you're a layperson, there'll be a conference for you, and if you're a practitioner, there'll be one for you too. They're coming up in April. We're going to talk to Shannon Goosen today about what's going to be conducted in those conferences and how it would be that you could benefit from participating. So Shannon Goosen is our guest today. She comes with us each and every month, but a topic in especial because of the up-and-coming conferences, training conferences in the month of April. That'll be April 10, 11, and 12. We'll give you a lot more information before the show is over with today. Now, during our discussion today with Shannon, you want to call in to ask a question or make a comment. The number to do that, as you should know by now, is to dial us up at 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. Okay, let's see what else is on the map here. Now, at the end of the week, I'll be in the Big D, Dallas, for an ozone conference, and I'll be bringing you back a whole host of new guests, Dr. Schallenberger, and advisories, and well, it'll be just an exciting time. This is the mandatory conference for all of us who do ozone therapy, and that's this weekend. So on Friday, at least, there will not be a live show. If you have an idea for one you'd like to rehear, you can give us a call or send me an email, and I will try to comply. The guesting for the rest of the month, because we're going to have Dr. Coppola with me. Now, he's the head of the integrative medicine program at something called LACOM. Now, you see advertisements for LACOM a lot on television, but this is the Lake Erie College of Osteopathic Medicine. And I have found out, because I have investigated, they actually have an integrative medicine department. Unbelievable. We're going to be talking to him this month and finding out from him just how that came about and what happens at LACOM to be able to stamp out doctors who are conversant with integrative medicine, because I didn't know that it was even possible to do that. So we'll bring him to you. As I turn the page, looking in the month of March, and we got a couple of weeks to go, but right off the bat, first Monday will be Susie Weiss, of course, talking about Young Living and essential oils. Then on Wednesday, the 4th, Dr. Vavavoom herself, Dr. Susan Smith-Jones, will be our guest. Looking forward to having them both on board. Hope you get your copy of the Journal of Lifestyle Management article that I have written on microcurrent. Pretty much tears it down to its basic components and allows you no matter where you've come in the door on this one, to really appreciate and get the essence of what microcurrent therapy is all about. So the Journal of Lifestyle Medicine Winter Edition would be highly recommended that you take a look at. We certainly have a large number of copies here in the office. They're found throughout all sorts of health food stores in the Western Pennsylvania area, and multiple doctors' offices. Come on in and get a copy. They are free. Now, we also have finally a large number of the top 20 alternative medicine doctor books. These were put together after we met in Phoenix in this past summer for the Top Doc Conference. There were 20 selected. I was lucky enough to really be considered as one of them, and we all wrote a chapter in a book. And many of those doctors who contributed to the book we had on this radio show, you know them. I'm looking down through a long list. Let's see, where was Dr. Cowden's been here, Dr. Gordon, Dr. Conrad, where else? Dr. Nicholas Myers, Dr. Nebling's been here, Dr. Schwengel, Dr. Schellenberger, Bruce Shelton. The list goes on and on and on. Each of them brought their small message to you, but in the large sense, this is the only place I know that their messages have been compiled, put together, and let you continue to have a lasting remembrance of those messages in a nice, neat little book called The Top 20 Alternative Doctors. We got plenty of copies here in the office. Come on in. They're $25. They're $35 on Amazon, I'm told. And spare the shipping. Come on in and pick one up. The Top 20 Alternative Doctors. And use it there. Your best behalf. What else? Okay. Ty Vincent, by the way. I thought Friday's show was just out of the park. Home run. Ty Vincent coming on board, spending an hour with us talking about LDI, low dose immunotherapy, and really focusing and honing in on the autoimmune component. A lot on Lyme's disease. If you missed that third show, keep in mind you can go to the website at djcmd.com. On the opening page, click on the icon marked Archives, and that takes you onto the YouTube. And YouTube, just scroll, won't have to go too far. You'll find the show for February the 13th, and enjoy listening to Ty do what I thought was a stellar job. Now, we'll be putting together, I haven't gotten my copies of the show yet, but we're putting together all three of his shows, part 1, 2, and 3. They started back in December, one installment in January, and now this latest rounds out the trilogy. And for those of you who really want to have a lasting remembrance and a concise description of what low-dose immunotherapy is all about, I'll let you know when these are going to be available, and we'll try to make them very inexpensive. I think $5 is what we normally have charged for them, to give you that lasting remembrance to have too. So I just refer you to head to the website. You can dial all three of the shows up. It was December 8th, January 12th, and February 13th, the three shows with Dr. Ty Vincent, the new guru, the person who had been passed the baton from Dr. William Butch Schrader, is going to be a big hit around here. And we will bring him back. It's just that we have completed the group of three, and we'll let it go at that for a while. Okay. Why don't we do this? We're going to take a short break. In the interim, we're going to connect with our good friend, Shannon Goosen. She's really knowledgeable when it comes to frequency-specific microcurrent. She is absolutely unbelievable at teaching FSM, and we put a package together I think you're going to be happy with. She's coming to town, folks. So way out into April, you can plan for it. Lay persons, you have a day for you. Practitioners, you got 2 days for you. We'll let Dr. Shannon Goosen, I call her the doc, talk to us about frequency-specific microcurrent when we return, and we will be right back with Shannon. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Monday morning version of the show, but a special Monday. Certainly, a young lady keeps coming on back to bring us information on a topic that's hot. And I mean it's really hot because its capabilities they're boundless. They have the ability, it has the ability of getting you out of some pretty difficult medical jams when nothing else works. And the simplicity of it all from the viewpoint of the utilizer is, why didn't anybody think of this before? It's called microcurrent, frequency-specific microcurrent to be exact. And this young lady knows everything about it. She's been our guest a number of times. She continues to come back today. She's with us once again, announcing training up and coming for those who have that interest. We'll be talking about it today with Ms. Shannon Goosen. Welcome, Shannon. Thanks for coming aboard once again.
Dennis, great to be back. Thank you. And it was just fabulous to get up to Pittsburgh and be able to visit you and see your wonderful clinic and meet some of your clients and just be able to enjoy all my favorite people in Pittsburgh. So thank you for having me back. And I love Microcurrent Mondays.
Microcurrent Mondays are extra special around here. That was an extra special weekend just a few weekends ago now. And with you coming to Pittsburgh, you really lit the fire up. We packed the office that morning. It was a Saturday morning. It was done impromptu. But what we learned was there's a thirst for this information on the part of patients, the lay public in general, practitioners, and seeing that need, we just took it to its next logical progression, which we're going to be talking about this morning, taking this from just a general lecture to specifically training people in what they need to know about it. Let's get into this bit because your own training in microcurrent has had a unbelievably involved past. How many years worth of training has this been? And how about maybe relaying to our listeners, as you began microcurrent training, it was certainly a new science to you too. Some of the stumbles and the pitfalls that you found that were common to many, and that I get the impression you sort of ironed those things out. But first, let's hear about your own training, how lengthy it's been, and really you have succeeded to arrive to a level of being able to train and certified to do so. I'd like my listeners to know about that. Take it away.
Well, I first got introduced, to microcurrent through Jeff Rockwell and then also through myofascial trigger point therapy, because there were a lot of therapists that were using the single channel and 2-channel boxes, the old men's machines, to deal with inflammation and reduce pain after treatment. So I had seen microcurrent used and knew that it was out there and knew that it was available for pain reduction, and didn't fully grasp onto it. I was still quite the neophyte in learning all of the pain work. And then I got introduced to Carolyn McMakin, and that was right around 1998 or 99. And she was doing something new and novel with microcurrent. She'd had a microcurrent box, the blue box that you keep hearing about, in her office, and she was doing some aesthetics with it to earn extra income. And she discovered that she could actually deal with myofascial pain and make muscle pain change. And then she started experimenting with other frequencies for other conditions. So she stumbled onto this, and then when she wanted to see if she could reproduce her results, she naturally started training people to see if they could do what she had done. So I met Carolyn McMakin through another physician, Shirley Hartman, who's here in Jacksonville and has always done complementary and alternative medicine. So we ended up bringing Carolyn McMakin to Jacksonville, Florida, so that we could get trained. And this occurred after she had presented at an IFM meeting, the Institute for Functional Medicine, and she presented that initial data that we've talked about before that had to do with how we modulate inflammatory cytokines when we use two frequency combinations, 40 and 10, for inflammation in the spinal cord, and she had successfully reduced the pain in many people from fibromyalgia and had found a way to actually resolve it, supposedly a condition that you can never get over, which is not true. You can absolutely get over it. So we got Carolyn McMakin to come to Jacksonville to teach. I organized training seminars here. I was actually in acupuncture school at the time. And we did this training, which in those years was done on a whiteboard with markers, incredibly difficult. There were no PowerPoints in use for this yet. And I, at that time, was fascinated by it, saw what it could do, and had great difficulty in learning it and figuring out how to implement it. I actually ended up using another microcurrent device that I had learned about, which at that time was called ETPS, which was a microcurrent point stimulation. Very easy to use, not specific frequencies though, and I was able to successfully make changes with low back pain and some other conditions and treat acupuncture points. So I grasped onto that for a while and learned about that. And then finally, when the automated units came out for frequency-specific microcurrent, which is a trade name that Dr. Carolyn McMakin has for explaining what she does, which is specific frequencies with microcurrent to treat conditions. So we call it frequency-specific microcurrent, or FSM. So when the automated units came out, Dennis, that was a game changer, because now you didn't have to remember all the frequencies, and if you understood a condition or a pathology, you could essentially press and go with these units, which means you put it on the patient, you turn it on, and you let it run the frequencies. And that is how I finally realized that I was going to be able to incorporate this into my clinic, which was a manual therapy and an acupuncture clinic. And then the next thing that happened was I realized that I was going to have to take this class over and over and over again, which I did. And I think about the fifth time that I took it, and then after being at some advanced trainings, Dr. McMakin asked me to teach for her. And so I became the instructor for the East Coast for frequency-specific seminars. And that is what really gave me my vertical learning curve. Because if you want to learn something, I'm telling you, all you have to do is teach it. Because so much is required for you to be prepared for the questions that may come from the audience and the practitioners. And there's so much to learn, because once you start peeling away the top layers of a subject, then you realize all of this depth underneath it. And that put me on that vertical learning curve with not only frequency-specific microcurrent, but really diving into physical medicine, neurology, and what is going on with neuroscience, and then with movement and exercise and nutrition, and the list goes on and on. Because once you learn about the frequencies and what we can do, you then want to make sure that the whole support system is there. So that is how I ended up on my vertical learning curve. And I continue to teach in all of these areas. And the natural thing that happened for me next, Dennis, was I realized that we needed to incorporate a lot of different energy medicine devices. So I became an independent instructor so that I had the ability to talk about everything that is out there. And so, as you know, I also became involved with Avazia, which is based out of Dallas, Texas, and that is the technology that Tim Smith brought to the forefront. And that microcurrent device actually has a microprocessor inside it, and it is able to communicate with your body and change the way the signals are going in, and we can get drastic changes in tissue, and we also now with that device have a way to get areas that people have not been able to feel or have not been able working properly. We can actually get the brain and the body connected in any area that has been cut off by a surgical scar, what trauma, whatever it might be. So there is just a wealth of information about what we can do using these specific frequencies, different types of waveforms, and bringing this current information into the body so the body can heal itself. So there in a nutshell in 7 minutes is my journey on how I got where I am today.
Well, in talking with you so much as I have done on this subject, I got the distinct impression it wasn't left to be gathered on my own. You were quite adept at pointing out this was difficult for you. This was something that, in the way at least it was presented to you, you had difficulty mastering it. And I thought that it was just uncanny for you to reveal that once you figured it out, you could put it in an explanation in another language that makes it simple for everybody. It was just how it was being presented. Did I hear that right? That you've had battles with it,
and that has to do with learning styles and how people take information in. And like I said, I had to take the class that I took, which was a 3-day introductory class. I had to take that at least 5 times, and no one was more shocked than me when I was asked to become an instructor, because I did not feel like I had any command over the information to stand up and teach it. And fortunately, what was said to me, it's like, well, that's okay, because we have all the frequencies on laminates, and what really matters is that you're a good teacher. And it's like, okay. And no one was more terrified the very first time that I got up to teach this. In the process of doing it, meaning teaching, what I clearly learned was, oh my gosh, this is a language. And I am one of those people that just didn't seem to get the language gene. What I did get was the math gene. And so I'm very, very good with numbers, very, very fast with numbers. Math is easy for me. And because this is all in numbers, I originally thought, oh, this is going to be a breeze. It's numbers. Well, it wasn't, because it's language. And as soon as I understood that and went, oh, I know what the challenge is here. I don't do languages. I came up with a way to identify the people in my training that were going to have the same challenge that I did because of the language, and then develop a way to communicate with them so they could hook the information in their brain in a way that would make sense to them, so they could remember some of these frequencies, because it does help to remember a core of the frequency, because it speeds up what you can do in the clinic. And then I was able to take all of my physical medicine training. As you know, my husband is an orthopedic spine surgeon, and I travel in many worlds, and I tell people I live on both sides of the railroad tracks. So in my allopathic world and surgery world, I was able to interface and learn from so many brilliant surgeons and neurologists and people that just had great command over orthopedics, including therapists. So I was able to soak up all of that information and then figure out a way to easily communicate how you would look at what is going on with someone and apply all these simple evaluation skills, which I have developed to make what would seem a scary thing. It's like, oh my gosh, I could never do a neurological examination, and I've got a block to that, and I would never be able to learn that. I have figured out how to make it fast, easy, and fun so that people remember. And I do the same with orthopedic evaluations, spine evaluations, and then that's what allows us to then get into being able to apply these frequencies. And then I've made it fun and easy and entertaining for people to learn some of the core frequencies. So we've found that people learn this information faster, they have fun, and by the end of the course, they're invigorated and they actually want to do more, as opposed to just being exhausted and things spilling out of their brain and having the feeling that they're never going to be able to learn it. So that is what I really, really worked on and brought to the table to help people. Because if you can't learn it, you can't use it, and if you can't use it, you can't apply it with your patients, and it's life-changing. And so everyone should have access to this, so we need to make sure that we can successfully train practitioners to be able to embrace this and apply it.
Now, you were just so quick to point out that that's what your expertise really is, to teach, to train. And that's really your fondest desires, to be involved at that level. Thank goodness that you feel so strongly about it. It's the one thing we need up here. And I know you're going to help us out in starting those rudimentary beginnings to get people knowledgeable in frequency-specific microcurrent. When I asked you, all right, Shannon, when do we want to do this? And lay out for me what you have in mind. You came up with a two-tiered program that I said, oh, yes, that makes so much sense. And that you said, look, we need to have a special program for lay people, people that aren't practitioners, people that maybe just be using these units for themselves or other members in the family. And then we need to separate out those who have other motivations and other aspirations and use this on people in a professional sense. We'll call them practitioners. And so you pointed out these lay people really needed to be trained. Could you elaborate on why you felt so strongly about it? I wasn't thinking about them at all. I was thinking about practitioners the entire time. But since you mentioned it, I'm very excited about having lay people because they filled this room with you 2 weeks ago. They were swinging from the rafters. They are energetic. They are enthusiastic. And they shouldn't be cut out of this. So how do we do these two? Are they similar in any way? Are they different in any way? How is it that we are going to have a seminar for lay people and one for practitioners? Take it away.
Well, Dennis, if I go to the very core of why that would be so important, regardless of what the subject is, and of course my passion is microcurrent, is we are now in an information age. And regardless of what someone's training is, regardless of what their profession is, regardless of what their interests were in school, their degrees, their license, whatever, it doesn't matter. There is no rule written that says that you're not allowed to learn about medicine or energy medicine or nutrition, even if you're not a licensed practitioner. So I'm not a neurologist. I'm allowed to learn about neurology, though. I am not a neuroscience. I'm allowed to learn about neuroscience. I am not a professional nutritionist. I'm allowed to learn about nutrition. So lay people have that same opportunity and gift. There is nothing to say that you're not allowed to learn. And that's the first thing that needs to come to the forefront. People need to have access to as much information as they want to empower themselves to have knowledge to be able to ask informed questions about their own personal health care. When we empower people with information and knowledge, they're able to go back to their practitioners and say, you know, I think that this would really help me. I think that this is beneficial. I think that this has a place in healthcare, and practitioners should be making sure that patients have access to energy medicine modalities and frequency-specific microcurrent and different types of energy medicine that will profoundly improve their health and well-being. And they need to have the opportunity to get the information, to get the science, to get the research articles, and to understand conceptually how it works in the body. So first and foremost, let's empower everybody because, you know, at some point, most of us will end up being a patient for something. So let's get empowered as individuals with knowledge so that we can spread that knowledge and then ask for what we want out of our healthcare system. So let's start with the consumer driving the bus on what needs to happen. And then we need to make sure that practitioners have the science, have the research, know how to safely apply these technologies and this modality, and know how to think about solving complex medical problems, health problems, pain problems for people, and being able to effectively and efficiently apply these modalities so they're successful. And then that is what brings it forward. So there's all kinds of instances out there that you probably know about also, where you had someone that didn't have enough knowledge about what they were doing, and they didn't get the proper outcomes, and so then it's determined that it doesn't work. Well, what really has happened is that it didn't work in the hands of that practitioner because they were not well trained. And of course, we saw that over and over and over again with people trying to treat myofascial pain, and they didn't have good palpation skills, good differential diagnosis skills, and so people would say, oh, well, that doesn't work. Well, it doesn't work when the practitioners are not well trained. So let's get the consumer educated, empower them with information, empower them with knowledge, and then let's get practitioners well trained so that they can be at the head of the traffic signal. So people know what to do with their devices, and people have well-trained practitioners that they can go to for counsel and advice. That's my vision.
Perfect. Now, we've already penciled in, and it's not any pencil anymore. It's in dark ink, and it's typewritten. You are coming to town, and we're going to do these training seminars in the second weekend in April. It's April 10, 11, and 12. And on April 10th, you said, you know what? We need to have one day just for them. All those people, all those lay people, the practitioners, people who are using these devices for themselves or have other family members, they need their own day, and that'll be on April 10th. That's a Friday. That's all day. And then for practitioners, those that move to another level of participation, they're going to be sort of a day and a half format for them, where they're all day Saturday and half a day Sunday. So that's April 10, Friday for lay people, and 11, 12 for practitioners. And it's all going to be held at the Crown Plaza here in the South Hills, right across the street from the South Hills Village. So that's moved from the abstract to the specific. It's now etched in granite, and it's going to happen so folks who are out there can start contemplating if they think they'd like to be involved, and then give us a call, 724-942-3002, so we can reserve a slot for them. Now, Shannon, let's take the layperson component and expound just a bit on, I think people out there may be a little spooked and wondering, geez, am I going to be able to do this? So let's first answer the question about their doubts. Can this be something that can be learned at that level for what the layperson needs to know? Pretty much everybody able to do it, or is this going to be something that only a few should feel like they can step up because these are very difficult concepts? I got a feeling that they were difficult once to you, but you simplify them. I think you're the perfect person to simplify them for everybody. Anyway, what do you think about that?
Well, you will have people that have equipment, and they will only be able to get equipment by prescription and through a licensed healthcare provider that is able to provide microcurrent equipment for specific issues for them and their family. So they are going to have someone that is going to be their support and the captain of the ship, so to speak. The other side of it is that there are so many conditions and things that can happen in day-to-day life. And when the individual that has one of these units gets trained on the possibilities of what they can do, whenever anything happens, they go, oh, I bet I've got a frequency for that. And so it's very, very easy to train people conceptually on what you're doing and how to think about applying microcurrent. And present all the possibilities of where microcurrent can be applied, so that they have an open mind to know, oh my gosh, I bet I've got a frequency for this, or I can call and ask to have my unit programmed so that I've got this particular set of frequencies on my unit for X, Y, and Z problem. So what the layperson can look forward to is we're actually going to have a conversation about medicine, about health, about the things that go wrong in our bodies and things that we get exposed to and things that can happen, and how they can conceptually think about being able to apply frequencies to alleviate those conditions and or just completely resolve them. And of course, you and I have talked over and over and over again that microcurrent shines when there is trauma or new injuries or something acute happens. So we really want to make sure that people have all of those programs on their units just in case. It's like having a first aid kit, but it's your emergency medicine device that is going to dramatically change the outcome of what might have happened. And they will then understand how we think about this and how we would apply these different programs and these frequency combinations to resolve the A to Z of, basically the medical dictionary of things that can happen. Mm-hmm. So that's where the consumer will get empowered, and they will learn enough to be able to ask the question to say, oh, I need a program for this.
Well, as I've been involved with microcurrent for some time now, I see how this grows. A patient presents themselves. They have a specific problem. Up till now, it's been a lot with eyes. And I've seen this happen in front of me over and over again. The patient comes in and learns how to use the microcurrent device for their eye issue. And, of course, with Dr. Conrad's help, we've been very successful with eye issues. But a lot of times their partner, their spouse, is along with them. And then they say, well, you know what? My husband or my wife who's sitting next to me while I'm doing this, they have this problem. They have that problem. Could we maybe come up with a program for them? And then it's not too much longer that I hear, well, our daughter has it. So what I see happening, Shannon, is these devices look like they could handle families, that the entire family literally can have a program or two devoted to them or whatever is happening at that time. These devices are that versatile and universal that they can be brought into play for just about everybody in the family, for just about anything going on. Do you see that as the role for microcurrent now and or in the near future?
It's now, and it has been occurring in my practice for years. So what I can tell you is one person comes in to get treated, and we sort out what's going on. They buy a microcurrent unit so they can treat themselves at home, and then the next thing you know, something happens with a family member, and then it's like, okay, well, you've got this program and go ahead and run it, and then lo and behold, it works, and then that person wants their own device. And so I have all these funny instances of where one person in the family gets a microcurrent device, and then everybody wants their own because they see what can happen once they get exposed to it and see the benefit. So we absolutely have families where, everybody has been evaluated, and we do an intake and get a history and get information and gather all of it. Then we're able to make sure that we have programs for the family. And the other thing that happens is I always have, like I said, my emergency medicine programs and frequencies are always on the units that go out of my office, including one that's specific to shingles that we use. And so everybody gets that. And then I coach everybody, okay, in the event that anybody starts to come down with a shingles outbreak and their predomal, so the blisters haven't come out, but they've got the pain in a particular nerve root pattern, and it's like, get these frequencies on them right away, because we can usually abort the outbreak from ever happening. And so we have programs like that just automatically go on, just in case. And you're spot on that, we get these units so that we can have the whole family, have access to it and could get appropriate programs. And then in the event that something, we'll just call it bad, something bad happens, we have those emergency medicine frequency combinations that have consistently worked so well for people.
Well, I'm excited for the laypersons out there who, many of them who were in the audience that you spoke at a couple of weeks ago, literally had their own unit in their hands, but their spouses came with them, other family members came with them, and they had such a thirst that they need quenched for knowledge. And I'm so happy to see that you feel the need to include them right from the beginning and get them educated to let them become the sophisticated user of the microcurrent unit. So we have not forgotten. In fact, we started out by describing that the layperson is going to be involved. Their day is April 10. More and more as time moves on. I want to switch gears because I want to pay some attention to the other level, the one that sort of makes sense, that there needs to be training for practitioners, and that training more than likely is ongoing training because their level of performance needs to be to excel over and above that what a layperson may need to use the devices for. The practitioner is where these decisions, these clinical decisions get made. And so describe what I think you've been involved with for a long time, training the practitioners throughout the Eastern Seaboard. You said you were the training expert, the designated trainer for all the East Coast. What have you found? Who out there listening to us right now should consider themselves at the practitioner level? Who should be in that group? It's going to be on the 11th and 12th at the Crown Plaza Hotel.
Well, first and foremost, physicians would benefit from getting this information and would need the training from the standpoint of having people work with them, either assistants or therapists of any kind that would actually be the foot soldiers that would be working directly with and interfacing with the patients. And so I always recommend whoever is at, the head of that clinic or in charge of maybe physical medicine, they benefit tremendously from understanding the framework on how we use these frequencies so that they can communicate with the practitioners that are working with them that may be directly working with the patients. So it's layers. Certainly chiropractors, and then physical therapists, occupational therapists, dentists can benefit from this. You can just have an entire practice dealing from the neck up and make tremendous changes with people. And massage therapists. Now, massage therapists would need to work under a practitioner that is licensed to apply microcurrent therapies and any kind of electrical treatment. However, I would let the other practitioners know that when you have these manual therapists that are experts in treating the muscles and are used to being in the physical body and spending time with patients, they are your greatest asset because they are already trained to be spending the time to be talking with people, and they are used to kinesthetic medicine and working with people. So they are some of the most useful practitioners for applying microcurrent because it's natural for them to understand the physical body. So any practitioner that is interested in physical medicine, I highly, highly recommend this course. What the people that attended the trainings taught me was that everything kind of fell out of their brain from the things that they weren't able to treat, because in the Western medicine model that we had, there wasn't any way to treat X, Y, and Z. So there's no reason for me to pay attention to this information. And so what the students taught me consistently, and this is everywhere from physicians that were neurologists to orthopedic doctors to chiropractors to physical therapists, was that there was a lot of physical medicine that they just forgot from a standpoint of differential diagnosis because they didn't think there was anything they could do about it. So I take a a lot of time to go back, revisit that, and then show them the frequencies that we can apply to resolve that. The first one being, again, 40 and 10, that Dr. McMakin figured out, inflammation in the spinal cord. You have to be able to do a neurological motor sensory examination to be able to find the subtleties to let you know that that's going on. And Dr. Courtney, you actually saw me do that in the clinic 2 weeks ago. And that person had been to a neurologist over and over again who said they couldn't really find anything. And then, of course, I found the subtleties and we applied the correct frequencies and we saw the pain disappear in an hour. So I go back and I understand why people had that information fall out of their brain, because there wasn't anything they could do about it. There wasn't anything they could do about a disc. There wasn't anything they could do about facet joint disease. There wasn't anything they could do maybe extensively with nerve pain or some kind of neuropathic issue or a small fiber neuropathy, diabetic neuropathy. We have all of these things. And so I give everybody an opportunity to revisit all of those diagnoses and then give them a way to actually treat it quickly and effectively. So then that information matters and they can go back and apply what they learned when they were in school in a meaningful way, because they actually were going to be able to get results in resolving the problem. That is what I'm passionate about, and we have the most fun with that part of the class because we all get to revisit it as a group, think through it, learn it quickly. I have very, very easy ways for people to learn these things that they think they should be afraid of, that they can't learn. It's fun, it's easy, it's meaningful, and then lo and behold, you can do something about it as soon as you find it.
Well, I think we're going to appeal to a group of people out there who didn't know this help was available to them to make their job better, to get their results highly improved from where they are right now. And we're putting out that open call to those who'd like to learn more about microcurrent, frequency-specific microcurrent, to how to change their practice. If you're involved with patients who have any pain problem whatsoever, you just can't be without FSM. You just can't. And right now, for the most part, maybe you have been without it, and that's why your patients never seem to get better and they move on. Because, Shannon, I know that people that you treat get better and they do move on, and they have some terrible diagnoses, almost to the point where they expect, well, things are never going to change for me, and it turns out they absolutely can. After all, I remember meeting a girl from Jacksonville who was fibromyalgic, and her life was pretty much wasted. That girl has ascended to a level of functionality right now that puts her at the top of her game. And what a story that you tell personally, and that can translate to others who, if they're not going through it themselves, are at least seeing people every day on a daily basis who are.
Absolutely. And Dennis, the other thing that I would like to send out and invite practitioners, if you are already using some type of energy medicine device, come to this class anyway, because I talk about a variety of energy medicine devices, as you know, and we can actually have the conversation about where different devices shine. And no one device, in my opinion, is a cure-all. We haven't seen that yet. However, these devices shine in very, very specific areas, and if we can hone our skills to go, this is a time where I need to be using this. So I will be talking about Avasia. We can talk about lasers. We can talk about pulse electromagnetic field therapy. And I want to have those conversations so that we look at energy medicine and application and where we can do the best good for our patients and for ourselves. And the missing piece for me, for most people, is not having access to these microcurrent therapies that do a tremendous job at modulating the nervous system and reconnecting the brain to the body and improving general health and even the immune system in people. So I encourage everybody to come out, even if you just want a refresher on physical medicine. this is the class for you.
Now, speaking of practitioners, I would be remiss if I didn't mention that because of your visit to town and sort of rekindling your relationships with well-known to you and from our area, we have developed a relationship with a gentleman I've known for years, and one that you think very highly of, also who has been trained with microcurrent and has been using it many years. His name is Richard Finn. Do you want to tell our listeners, because Richard is going to be in our office, he starts next week, 1 week from today, and he's going to be seeing patients. We're going to be working with him side by side. We're going to be dialoguing, he and I, to get through some pretty complex issues to come up with the solution, the frequency-specific solution for, we hope, just about everybody we see. Could you please let our listeners know from your perspective, because you've known him a long time, about Richard Finn?
Well, for starters, Richard was one of the people that was my trainer and teacher for myofascial trigger point therapy. So my relationship with the Pittsburgh crew, my Pittsburgh peeps, as I call them, is because I flew up probably once a month or every other weekend and did intensive training with Richard when he was at the Pittsburgh School of Pain Management and running that school that was specific for teaching myofascial trigger point therapy. So my relationship goes way back with Richard, with me actually being the student, just like with you, I was the student. And Richard has been in the field of physical medicine and has stayed on a vertical learning curve, and he is also an instructor. He is the perfect person to be in your office, Dennis, because this is exactly what I was talking about, where you want to have the medical director come and learn this information and then have someone like a Richard in their office, because these are the people that know how to spend the time, ask the questions, and get the information out of people and evaluate them to see what is going on to treat all these physical medicine problems. They are trained to look for it, find it, ask the questions, and then spend the time that is needed with the patient in order to do the treatment. So someone like Richard is really just a perfect match for somebody that is the medical director of a clinic that's dealing with any kind of pain problem. So it frees the doctor up, so because they don't have an hour with every patient, but you have an extender that has a tremendous amount of knowledge that is then able to directly take care of your patients with this. And then you have a medical director that is able to order any tests or imaging or anything else that might need to get done to make sure that you have a correct differential diagnosis. So it's a great medical marriage for any kind of clinic that is taking care of people that have any chronic pain issues. So you're going to enjoy it. You're going to enjoy it.
Oh, I'm already enjoying it. And for those out there who are physicians, who are chiropractors, who run offices, you need to develop a Richard Finn. You need to have a Shannon Goosen around and near you to allow you to get the maximum input from a clinician toward to a patient and their problem that you may not be quite on that page just yet. You're going to need some help. The learning curve is steep, but you can flatten it out by having people around you with that level of expertise. I'm so looking forward to having Richard here. I want to thank, of course, I met Richard way back when you were being trained by him, and who knew then our paths would cross these many years later, but they certainly have. And of course, we want to thank you for making that introduction once again. And we just couldn't let him slip through our fingertips. We had to bring him inside. We had to bring him aboard.
Fabulous.
Well, Shannon, we are looking forward to this burgeoning relationship. Now that we've announced there is training, it is available. It's going to be for laypersons who have no designs on treating others other than themselves and other family members, and then those who make an art form of treating everybody, all comers who come to them each and every day. These two divisions are going to be met with the level of expertise that they will each be able to walk away from and be more greatly enriched than they were on the way in the door. I want to thank you, Shannon, for getting that spark lit around here. Pittsburgh's been in a dead zone. We have not really caught on. We haven't been a guiding light in the microcurrent realm that I think we should be, and I believe we are about to break out of those constraints and develop into the class operation that I think we'd like to be, and we are going to be. Thank you so much.
Thank you. I love Microcurrent Mondays.
I know, I love them too. Well, Shannon, thank you very much. I'm going to say goodbye to you now. Look forward to be talking to you off air many times in the course of this month. Looking forward to bringing you back next month. Richard Finn starts next week. He's going to be in the office, and you'll be hearing a lot of blurbs from him too. So onward and upward. Microcurrent lives, eats, and breathes here in Western Pennsylvania. And it's you, Shannon, that brought it back.
Let's go.
Let's go. All right, Shannon, thank you so much.
Okay, thank you.
There you have it, ladies and gentlemen. Shannon Goosen, lighting the fire. Lit the wick not too long ago. The full-fledged fire and flames are engulfing us now. Get ready for that seminar, training seminar, April 10, 11, and 12 at the Crown Plaza out here in the South Hills. And more about that up and coming. If you have an interest, you want to give us a call, 724-942-3002. That's 724-942-3002. You want to talk to Sister Sarah, and she'll convey to you the known information at the time. I would say this will all be out and published within the week. Bill has blasted us. It's time to get on out of here. Have a wonderful day. Stay warm today. Stay inside if you can. I look forward to be with you on Wednesday. Until then, this is Dr. Dennis Courtney with Shannon Goosen saying so long for AM Impact on Your Health.